We're here with another Superior Health Wednesday, joined as always by Jim LaJoy, Executive Director at Superior Health Foundation. This morning we have a special guest, Clark Harder with the Michigan Public Transit Association. Thanks for being here, both of you.
Welcome. Glad to be here.
So we're talking about certain grant awards and how it's going to benefit the Public Transit Association. Jim, if we could start with you and kind of talk about the grant award, what it entails, how it came about, and what it's going to be able to do.
Sure, be happy to. So with the Superior Health Foundation, every couple of years, we focus on a larger grant proposal, which we call our proactive grant funding. And essentially what we look for, Ben, are those topics that are centric to a wide range of people in the Upper Peninsula. So we agreed a number of years ago that we would dedicate 2/3 of our annual large grant funding to a proactive grant project. So over the years, we have funded improving oral health for children, childhood obesity, mental health, drug use issues in the UP, and those issues. Addressing non-emergent medical transportation has really been an issue that we wanted to address a number of years ago, because with the remoteness of the UP and the rural nature of the Upper Peninsula, we know that there are a number of folks who struggle to find adequate transportation to get to and from medical appointments. And we decided back in 2019 that we were going to make this our proactive grant giving initiative, knowing that it was going to be a real heavy lift because of the dynamics of the UP. But we were very thankful that we were able to put $800,000 into this over a 2-year period, and we sought RFPs. And at the end of the day, Clark and his group had really the best plan and the best model to develop in the Upper Peninsula. And we went with that. And I can tell you, speaking for us on the foundation level and for the board of directors, we are just tickled with the progress that has been made and the number of patients and their families who have been able to be connected and get to their destination. So it has turned out to be wonderful, and Clark and his group have been terrific to work with.
That's excellent. So let's just transition into that. So Clark, if we can talk about Connect UP and this Rides to Wellness initiative, just first give us an introduction of what it is that you do and how you help people in our community.
Sure, Ben. The Michigan Public Transit Association has actually been around here for 44 years in Michigan. We originally were founded to be an advocacy group for the public transit agencies, which are located throughout the state. There are 82 separate transit agencies, and then a number of community groups that also receive state funding and federal funding for transporting people. So we represent a majority of those around the state. In the Upper Peninsula, we have 10 organized transit operators, and they stretch all the way from Houghton Hancock down to Ironwood and across all the way to the Sioux and all points in between, with a few counties that are exceptions. So when Superior Foundation put out their request for proposals, we took a very careful look at this. We have had a sister spin-off organization at the MPTA called the Michigan Transportation Connection since 2014. So 7 years of building that program. And it's a nonprofit organization that began its operations trying to connect public transit agencies to more of the non-emergent medical transportation in the state. And we have a number of projects in Lower Michigan that we've been working on since 2014. Connect UP is really unique. The geography of the Upper Peninsula, the weather that we deal with, of course, this time of year on a very regular basis, the big distances between medical providers and people who need non-emergency medical are great. So we didn't jump into this project lightly. We thought about it very carefully before putting our proposal in to Superior, and we were delighted to be the approved grant recipient in fall of 2019. So we're just a little bit over 1 year into the actual program. We began transporting our first passengers under Connect UP, or as we sometimes call it, Rides to Wellness, which is a term that is used in other places around the country for the same sort of thing we do. In the first year, the very first month, we had 2 trips in January last year. For the first year, we transported almost 1,850 people, which is rather remarkable considering that we had the infrastructure of the 10 transit agencies, but we still had to put together partnerships with some private carriers. We do utilize taxi services where they exist and where it's practical. But the core of our transportation is done by public transit agencies. And because these are unique trips, we don't typically, although some of the trips will be on regular transit vehicles, small transit buses in the UP, we also do a lot of these utilizing smaller vehicles, vans primarily, on the Upper Peninsula project. And so there's been some infrastructure build out we were dealing with. And at the end of 1 year, to have transported as many as we have, and it's been steadily growing. And I think you have a slide that shows that month by month, that we're close to actually scheduling 400 trips a month. We thought we were going to reach that in the month of January of this year, but then weather problems set in. We had a lot of cancellations. And of course, that's part of the whole uniqueness of the project is we schedule trips, we arrange for them, we find partners to help to fund going forward, and then we often have to backtrack because we do get weather-related cancellations, or in the fall when the Upper Peninsula COVID numbers kind of jumped, a lot of people canceled their their non-emergency medical appointments simply because they were staying home, and we understood that. So, it hasn't reached the level we thought it would quite yet, but we think as we get further into this year of 2021, with the COVID numbers dropping around the state, we expect we're going to be probably by summer easily transporting 500 or more every month.
That's an incredible number, starting from, and just what a perfect timing for this to start up here at a time right before we even knew COVID was a thing, and people were honestly concerned, and they weren't going and scheduling regular wellness appointments, going to see their doctor, doing these kind of things. That because of this, people had access. Yes, the weather gets in the way, but this was a great resource to come along at seemingly just the right time for the area. And hopefully this gets the word out and lets people know that they do have access to this. So if we could, who is this available to? Who can use this?
So basically anyone can utilize our services. We do work with a number of medical providers directly who often set up the appointments for their patients. One of the things that Superior was interested in, as we were too, is building a program that can be self-sustaining after the Superior Foundation money runs out at the end of year 2. And so we've been very carefully building our partnerships, recruiting organizations that do have access to some funding and a willingness to help fund this program going forward. And that's a very important part of the overall project. So basically anyone, though, can contact us. The easiest way is simply to dial 211. We have an agreement with the statewide 211 network. We utilize them all over the state. When you go into their system, which you can also access directly toll-free, that's the 844-532-7433 number. So when you get into the system, which 211 can put you into, you press 1, which puts you in direct contact with our operators. And another way is by emailing us. And our operations supervisor on Connect UP is Lori Blamer, and her email is at the bottom of our slide, lblamer@mitransit.com. And our website is mitransit.org. So we have both .com and .org, not to be confusing, but people can also find us and access us on the internet at the mitransit.org site.
We'll make sure to have all those links for everyone available in the web story when we publish this, so they can just click on it. They don't even have to remember it, type it, write it down. It's right there for them. And for ease of access as well, this is how people can use the system. Is there any way that people can either volunteer or help your mission going forward?
Well, on the Connect UP project, we to date have not used any volunteer drivers. However, in other parts of the state, through the years of our program, we have had agreements with volunteer drivers, and some of our volunteer drivers have been the greatest. So if there are people who are interested in doing that, they are typically paid volunteers. It's a minimal payment, but we do look at building those kinds of relationships too.
Good. And for people that are hearing this, other organizations that they've got big ambitions, they want to grow something like this. And this is for both of you, what's the relationship like of going through this process of the grant process of talking through this? If you want to talk about the experience with that and just how it all worked.
Well, I could speak to that. Whenever we put our proactive grant giving together, we assemble a large group of stakeholders that we bring to Marquette who have a vested interest in this. And Clark was one of those individuals who actually came to that stakeholder meeting. And it is a process because we want to listen. We want to hear where the models are that are working, where the holes are. And really, Ben, one of the driving factors, and pun is definitely intended here, with this whole project was when I travel and we travel to different parts of the Upper Peninsula, I heard from a couple of families about, some real horrific things that happened, including one instance where a elderly person actually died in their home because they did not have medical transportation to an appointment. And that really hit home for me. And, when you look at the scope of this project, it was incredibly daunting. But, a credit really goes to Clark and his team. The communication has been just terrific for that. And, to be able to have that, connectivity is just really, really terrific. And we are taking this one step further with a video that we're putting together that we're actually going to show to our board of directors in March, and it'll be available on our website that really shows the impact of this particular grant.
Good. And Clark, if there's anything you want to add about what the process was like for you. I know we touched about it originally, just talking through those initial things, but anything that you would say to encourage people about going through this?
The one thing I would recommend to anyone that sees this is that if you have a need for transportation to non-emergency medical, don't hesitate to contact our program. We will bend over backwards, literally, to put together transportation for you. We have a lot of resources, and we don't take no very easily. We find solutions for anyone who has a need for our services.
So there's no reason not to get the care you need.
That's right.
If transportation is an obstacle for you.
We'll figure it out. we'll get that transportation to you.
Good. For both of you, is there anything that we're missing on this that we haven't talked about yet that you'd like to make sure that we get out there?
No, I don't think so. I think that covers it. And I'm glad Clark talked about the ongoing need for sustainability. And, you know, his organization has done just a terrific job of reaching out to hospitals and other healthcare providers across the UP to generate that type of support for ongoing non-emergent medical transportation. That's important for us, because when we put dollars into a project, whether it's this or any other grant, we want to see it sustained. We don't want it to go away. And we think this can be a model, so to speak, for other rural communities across the United States. And it is just a semblance of something that really fell into place nicely and is benefiting a whole slew of people.
Excellent. Well, thank you both for all the work that you've been doing and that you are setting up to do in the future. I appreciate it. Clark, Jim, thank you both.
Thank
Thank
you,
you
Ben.
so much.